Hi, this is Dr. Christopher Maloney talking to you about removing your dental mercury fillings. And unlike almost any alternative practitioner you're talking to, I would say that I'm not a fan of pulling out all your fillings at the first drop of a hat. I would say that basically it's a very expensive procedure, usually $2,000 to $4,000, sometimes $6,000 to $8,000 to $10,000. And for most people who are chronically ill, it's a very bad idea because you're not going to be allergic to the mercury and you're not going to see an $8,000 to $10,000 benefit in your lifestyle. Whereas a lot of the other interventions that you would do, say taking 6 months off work and living and having that same $10,000 to, like, say, hang out in the Bahamas on a hammock, that might actually be a better idea for that person, just to be able to have that time off. I'm also not a huge fan of blaming all chronic disease on amalgam fillings, because they are a major factor for a tiny group of people who are allergic to mercury. They are a minor factor for a lot of people. Having mercury and active mercury levels in your body is not a great thing. I don't think anybody thinks it is. There's just an argument about how bad it is and how much of damage it can do. The problem is when you really get into the argument, you'll also realize that there are people who say, basically taking them out wrong, the wrong order, having canals open where the mercury is actually getting into the bloodstream is a really terrible thing as well. So there's really something to be said for going very slowly on this process. Now, that said, I'm also somebody who has mercury fillings in my mouth still, because I'm still waiting for the resin information to come back, and I'm looking for kind of the Pyrex model of glass fillings, where you're really going to look for a very break-resistant compound that's not going to off-gas. Because right now, mercury gives problems, but now we're putting in like a plasticized resin that can off-gas, and I'm really not a fan of putting something in. Now, the good dentists are testing for allergic reaction before it goes into you, but someone who's that reactive to mercury could well be reactive to the resin compounds. So there's something to be said of going very slow with that process, the amalgam fillings, and once you've had them out, you really want to be tested, not necessarily going through, I've seen people go through years of detoxification or chelation therapy afterwards, and I'm not a huge fan of that either, because that strips out not only the bad metals, but also good metals that you need. So it's really something to really be done very consciously, and not following what people do. Is they tend to go from, oh, it's not a problem at all, oh my gosh, what a terrible problem it is, I have to have it done right away. My answer is, in a minority of people who are frankly allergic to mercury, yes, it's a major issue. But for the vast majority of people I deal with, it is a part of the puzzle. It is not something you want to do overnight, quickly. You need to think about it, okay?